And we welcome you folks for joining us today. A lot's going on out here, a busy community like this one, lots of activities. We have tennis and golf and 250 clubs and organizations. But the reality is for all of us as we age, sometimes we develop those little aches and pains, maybe too much time at the practice green or too much time up on the tennis court. And we see the results of that in that next morning, maybe some aches and pains. Well, our next guest is an expert in sports and sports medicine. Marge Albohm is with us today, and she's the president of the National Athletic Trainers Association. Marge, welcome to Channel 6.
Thank you so much.
Your background actually started out at the college level, working with some of our top athletes in some of our colleges here in this country.
Yes, and elite athletes in Olympic Games. I had the privilege of working several Olympic Games. So I've transitioned my knowledge from that elite, high-level performer to the everyday person, people like you and me and viewers who really need to know about musculoskeletal care.
A lot of things go on out there, and we all think we're still 20 or 25, and we all think we can play basketball against our grandkids, and obviously we know we can't, or if we do, we pay the penalty the next day. But for a lot of people, it's not just their activities, it's really physical things that are happening in our body. Things like osteoarthritis really is impacting people. I understand that you've done quite a bit of work on osteoarthritis. Could you give us just a kind of a layman's definition of what it is?
Osteoarthritis is a degeneration of the cartilage that lines the ends of the bone. And you have bone on bone. You have no longer that protective Teflon coating that we're all born with, and as the skeleton ages, that often breaks down.
I guess we're finding as all of us age, we start taking little pills to take, maybe over-the-counter pills, and if that doesn't work, then we go see a rheumatologist maybe, and they'll say, oh, take this or take that, or maybe they get to the point where trying injections, and maybe even to the point of suggesting some kind of surgical procedure. So it can progress along, and I guess a lot of the people that were active in sports when they were in high school and college are maybe having that happen even sooner and more frequently as they age.
Yes, absolutely. And science shows, just recent science in the last 10 years, that those people who have had a significant knee injury as an athlete, anterior cruciate injury, and damage to the cartilage, may have an earlier progression to knee osteoarthritis. That's why we're finding knee OA in people 45, 55 years of age. The average age for total joint replacement used to be 72 years old.
Right.
That will decrease by 10 years in this next decade, which is a dramatic decrease.
Wow.
And the numbers of people suffering from osteoarthritis has expanded to the point where our government is calling it a national health epidemic.
Talk a bit about what traditionally has been done. I mentioned a few things, but maybe with your background, what happens to the aging athlete in the past? What was the treatment modality?
Well, I think if you look at the knee OA patient, progression to total knee replacement would be pretty quick because they would be in that older age group. Total knee replacement is a wonderful operation and successful, but then it has limitations. It changes your lifestyle. So if you're 50 years old and 55 years old, you might not want to have those lifestyle changes that are quite dramatic. So conservative management needs to be understood and needs to be pursued.
One thing we're going to talk about today is the topic of bracing. Has that become a new treatment, or has that always been available to people?
Well, we've had the unloader brace concept for several decades. I think people are very interested, much more interested from a physician standpoint and an active person standpoint, to see what conservatively can I do without having surgery. Not saying that a brace replaces surgery, but we have evidence that it delays surgery. And anytime you can delay surgery, even for a year, 2 years, 3 years, you have more normal use of that joint.
Talk about the unloader, a little bit about the product, how it was developed, and how long they've actually been working to make this available to the public.
Right, well actually it's a simple concept mechanically. If you have bone on bone in one compartment of your knee, you want something that unloads that bone on bone, takes the stress off of that no cartilage bone on bone. And the unloader basically does that. We've had that brace for probably 20 years. We've refined it. We have done more research on the unloader brace than any other brace company. Ossur has done that research and really has shown dramatic results in patient outcome studies. We've done the biomechanical studies, so we know what goes on in a lab, but we want to know what happens when people wear this brace. We want to know if their pain is reduced, if they've improved function, if they're reducing their usage of pain meds, And our research shows all of that to be true about unloader bracing.
It sounds like an exciting option to excess medication, which I understand there's a lot of risks when taking too many of those, whether it's over-the-counter or prescription pain medications.
Yeah.
I understand they can build up in the liver and other parts of the body and cause even further medical problems.
It's just not a natural state for us to take a lot of pharmaceuticals. We're kind of a pharmaceutical culture. We've grown up that way. But I'm encouraged by people's thinking to let's try something different. Let's try more natural ways and conservative measures to deal with musculoskeletal issues.
As you said a bit ago, we're finding that people are having difficulties with their joints and knees and other areas earlier in life. That may be because people were active as young people more, but you're finding that people in their 30s now are starting to have some of these problems as well.
Yes, and some of these conservative interventions like the brace are ideal for those patients who haven't progressed to the stage where your only option is surgery. Yeah. It hasn't progressed that long. You now use the brace to maintain your function and mobility and ease your discomfort.
You know, it sounds like a product that people might want to find out more about. Getting one, I understand you can't just go down to your drugstore and pull one off the shelf, correct?
That's correct, and that's probably a good thing. Ossur unloader braces are medical devices. Most unloader braces are medical devices. You need a physician's diagnosis to make sure you have knee osteoarthritis. Nobody wants to spend any money or waste any money getting something that doesn't match the condition that they have.
You know, basically, unless we're doctors by training or a sports medicine authority like yourself, we just know it hurts. We know that Monday morning after a weekend of playing whatever, trying to water ski again, say, or whatever, we know our knee hurts or our hip hurts or our foot hurts or whatever it might be. So we really don't know what the cause is. So we do need the doctor to tell us what's going on and what
Absolutely.
the problem is.
And you know, there are a lot of those aches and pains that we all have that are just part of our age and our musculoskeletal years.
Right.
But then there are persistent symptoms and pain that doesn't go away that indicates something more serious, and that's when a diagnosis is necessary.
I understand that you've done quite a bit of research helping them in developing this product and getting it available to the general public. I understand you've even supervised some studies being done by a pro golfer, and people actually improved their game. Now, you can't guarantee that.
Well, improve their swing. So
anyway.
When we do a swing analysis with and without the unloader brace, we clearly see that with the brace, the swing improves if you have knee osteoarthritis. So to me, that's incentive enough to learn more about this product.
Right. Well, I know everybody has tried bigger clubs, high-tech clubs,
Exactly.
different balls, different dimples in the ball, all kinds of tricks
Exactly.
to try and improve their game or stay competitive in the game.
Yes.
This could definitely be something that at least assists them in their swing. We can't guarantee how many strokes.
And more importantly, keeps them moving, keeps them walking
Yeah.
that course,
Yeah.
rather than feeling like they can't have to ride or
Yeah.
can't play 18. Keeping them active, mobile, and feeling good about their physical activity. That's what this brace does.
I understand that Billy Graham used to play a lot of golf, and that's how he would beat people, because he would insist that they walk the course.
Yeah.
And he was very fit and walked a lot. And he'd wear them out.
Right.
So maybe you folks want to take
Right.
that tip and wear your competitors out in your next foursome as well.
Absolutely.
How can someone find out more information? Obviously, not all the doctors are maybe knowledgeable about this. Might be something somebody would want to bring up and discuss with their doctor. How can they find out more information?
Right, so we have, Ossur has an excellent website at www.ossur.com, and you can definitely read the research, study the research, see the testimonials, and now with Google, I mean, everybody is a self-learner. Sit at that computer and Google and learn, and then you have information that then you can take to your physician and say, I know about this product. You're absolutely right that sometimes physicians are not aware of this product or the research associated with it. People need to be empowered when you go to your physician and have the knowledge to say, I want to try an unloader brace.
You know, it used to be we were really scared of that person in the white coat, a gentleman or lady who had those letters after their name. I think we're all becoming a little more forceful in speaking to our doctors and feeling a little more comfortable, and knowledge, as they say, is power. So
Absolutely.
do a little research, go online, check it out, and find out more. I understand you're continuing to work with them and developing even more research in this area.
Yes, absolutely. We have several ongoing studies right now that will add to our body of knowledge on the unloader brace, and we're very excited about that because that brings more information to the everyday person who needs to be helped.
Great. We thank you for joining us and sharing some good information with us. And if you folks want to find out more, there's the information on the screen for you there. The website, you can give them a call as well and find out more about this. Get some information, perhaps discuss it with your doctor, and this may be something that helps you to live better and feel better as well. Thanks again for joining us today. Good to have you with us.
My pleasure. Thank you.
And thank you folks for being with us. We'll continue on as we continue with more news for you right here on Channel 6 TV.